Hi guys, it's Kim BK Shea 2001. I'm coming today 3 weeks post-op tummy tuck. Well, I had my doctor appointment yesterday for another check, and that if you've seen my past videos, then you know that I have a blood blister right smack in the middle of the whole incision, and 2 or 3 days ago now, it stopped drying up on the outside edges where it meets the skin, and it was staying moist. And then today's Thursday, so Tuesday, I noticed after I got out of the shower that it was separating from the skin, which of course just made your stomach go ugh. And I noticed a slight smell. Gross. And so yesterday, like I said, I had my appointment anyway, and I still noticed the same thing, and it almost seemed worse. And then I started developing a headache, which isn't necessarily uncommon for me. And I was sitting waiting in the doctor's office, and then I got an overwhelming aches all over, and I just felt like crap. Turns out that that blood blister area was infected, and so what he did was completely remove it, and I have an open gap. I would say this is a Q-tip that they gave me. So I would say it's roughly as wide, or I shouldn't say wide, like this way, open, and then it's probably cut clear across from my finger to the end. So it's that wide and that tall. It doesn't hurt at all. I have no pain. I took a shower today, and he wanted me to take the gauze, and I have to stuff it with gauze in this hole. Ugh. I think, I absolutely love medicine. I'm fascinated with it, and I could watch it and probably perform it on anybody. I used to be a CNA back in the day, so, gore and stuff doesn't bother me, but when it's your own body and you're seeing this big old gaping hole, ugh. So, I had to re-stuff it last night. All this juice is coming out, excess fluid. There's no infection left that I can see. And he did say you'll probably start to feel better almost instantly. And I would say by the time I got home last night, a little after 6, the headache was already gone. But I did take some ibuprofen. And I just felt really good. And I had a very low grade fever. It was like 99.8 or 9 or something like that. So it was just starting. I'm on an antibiotic. I take it 3 times a day, 2 pills each time. So it's a pretty high dose. So taking a shower this morning, I forgot to ask him about showering, and I thought you'd leave the gauze in. Wrong. I have to take the gauze out, use a washcloth with antibiotic soap, and get in it. And then push around it any excess fluid that may come out. It's hard to tell because you're in the shower and you're wet anyway, so I don't know if there was any fluid that came out or not. By the time I had gotten home from the doctor's, I had soaked through my undies and my pants, and last night when I changed it, went to bed, got up this morning, and it was only through the gauze and the pad that I have covering it. Like I said, there's no pain at all, which is really freaky because you got this open gap in you. But I guess the only thing that I really kind of felt in the shower was like the outside edge of your skin. There's a slight ting like you got a paper cut. And that, of course, went away the minute you move from that area. I see him again this morning at 11:45, and that is just to verify that I'm doing what I'm supposed to be doing properly, putting in the gauze as far as I need to be putting it in. And so I take this long piece of gauze, I stretch it out, and then I use a long Q-tip, and I start pushing it in the hole. Again, no pain. I'm not even going to show it to you because it is that gross. It makes your body cringe. And I know if it was me, I'd want to see what you guys had going on, but I don't want to offend anyone. I don't want anyone vomiting. I don't want to hurt anyone in that sense. So, I mean, if you guys give me enough comments that you want to see it, I'll be happy to show it to you. It's pretty graphic. So I have to do this stuffing of the gauze for a week, and then next week he will, I think what he said, because I was in such a state of shock, that he will cut away anything that's left that's dead, and then he's going to re-stitch it closed. He said, you know, this can be very common, and so not to worry. And by the time he's done, it'll look like the rest of my incision all the way across. There won't be any big ugly scar. It'll just be a thin line, and I'll heal just fine. Even if there was, and I know some of you guys out there are who only did it because they had babies and excess skin, and for me it was a weight loss of a lot of excess skin. To me, that scarring, whether I had it bad or not, wouldn't faze me. I'm too old to be showing off my belly anyway, and he got rid of the most disgusting part to me anyway, the big huge stomach. So it's okay either way for me, but he says that he's going to get rid of it. So we should be good. I'm feeling fine. Everything else is good. I had asked him about going to work, and because it's open, I'm not. But I am going to try and work Saturday for 3 hours and see if I can go back Monday. So I'll ask him today, and we'll see what's going on. All right, guys, you have a great day, and I will, if I have any other important news after today's appointment, then I will let you know. Otherwise, I'll probably see you next week, my 4 weeks. Bye, guys.